This presentation will cover strategies for diffusing conflict and combative behavior in individuals with dementia. The objectives of this presentation will be to discuss the causes of combative behaviors, review ways to prevent conflict before it starts, and discuss ways to diffuse a conflict after it has started. What are some of the causes of conflict and combative behaviors? Here is a quick list of the common causes of conflict and combativeness. First, communication problems due to problems expressing themselves or understanding a conversation. Changes in functioning can cause frustration, especially if it is loss of performance of a task that they had been able to do before. Being unfamiliar with a place or people around them. Poor understanding of a situation. Sleeping problems. Feeling sick or being in pain. Anxiety or depression. Communication problems. The previous presentation on communication difficulties provides a more detailed overview of this problem, but in summary, often your loved one may have problems with communication due to difficulty speaking because they have forgotten words or have speech problems, difficulty hearing due to hearing loss, forgetting past or current events, being confused to person, place, situation, or time. Using communication to diffuse a conflict. The previous presentation on communication discussed ways we could improve communication to prevent conflict. What can you do if the conflict has already started? Here are some tips to use communication to diffuse an already tense situation. First, take a deep breath and be patient. Your loved one likely does not understand why you are upset, and they are not purposefully trying to upset you. If you notice your loved one is starting to become upset, immediately stop and assess what is upsetting them. Speak in a calm manner and give your loved one time to express themselves. Individuals with dementia often respond more to your tone of voice than what you are saying. Keep sentences to 5 words or less and repeat what you have said instead of using different words to explain yourself. Changes in functioning. Memory loss can often be very frustrating for your loved one because they begin to notice that they can no longer do some things as well as they used to. Changes in functioning are also difficult for caregivers because it can be difficult to know when to intervene and stop your loved one from performing tasks that they can no longer do in order to keep them safe. Preventing conflict due to changes in functioning. In order to avoid frustration, it may be helpful to adjust activities to your loved one's current skill level. Take into account current physical problems that are interfering with the ability to perform a task. Are there vision or hearing issues, for instance, that can be addressed in order to improve performance on a task? It can also be prudent to simplify everyday tasks like dressing, showering, and toileting as much as possible, especially if you start to notice that your loved one is having more difficulty performing tasks. Some ways to simplify tasks could be to pre-match pants and shirts with accessories, avoid buttons, get clothes with zippers or Velcro, avoid shoelaces, use slip-on shoes instead. If you are helping with a task, such as showering, explain what you are doing before you do it. If utensils cause frustration, try to provide finger foods at meals. Make sure to cut food into small, bite-sized pieces to make eating easier and more pleasurable. Consider having a commode at bedside to make evening bathroom trips more manageable. A special note on driving. Driving is a major source of conflict in many families, as this does cause a significant loss of independence. However, stopping driving when we feel that driving may be becoming difficult is essential to maintaining the safety of your loved ones and others. If driving is becoming a concern, speak with your loved one's primary physician about driving test options that are available in your area to test driving skill. When driving restrictions come from a medical professional, this can often be easier to enforce. If it has been recommended that your loved one cannot drive, please remove car keys from plain sight or place them in a place where they are not easily accessible. Consider selling or removing the car from the home so it is not a reminder about driving. It may be helpful to schedule time out of the home for you to drive somewhere that your loved one previously liked to visit. Confusion. As dementia progresses, it is not uncommon for your loved one to lose track of time, so they may not recall when it is time for important appointments or dates. They may even begin to forget familiar places and people. Due to confusion, your loved one may not be able to keep track of passing time, which can cause anxiety. Just a few minutes of being alone can feel like an eternity and cause a significant amount of stress for your loved one. Often, attempting to reorient your loved one can cause frustration for them and for you. This can spark arguments. Tips for preventing conflicts due to confusion. Have gentle reminders for orientation, such as a large calendar that is easily visible. Writing important dates on the large calendar can also be helpful for avoiding arguments and surprise when it comes time for the appointment. If you are leaving for a brief time, setting a timer or writing a note about what time you will return can help with the stress of being unable to keep track of time. Providing an enjoyable activity for them to do may also help with passing time while you are gone. Family pictures can be helpful to remind your loved ones about close friends and family. Valuable personal items can be made visible to reorient them that they are at home. Tips on diffusing a conflict due to confusion. Agree, never argue. If your loved one is already clearly distressed and appears to be becoming even more angry as you gently reorient them, it may not be the best time to try reorienting. Temporarily agreeing with them may diffuse the argument. You can attempt reorientation at a time when they are calmer. Attempt to distract your loved one. If they do not recognize where they are, for instance, and are insistent on leaving, encourage them to do another activity while you prepare to leave can help. Think about the root cause of the conflict. For instance, if your loved one is insistent on going home, although they are already at home, think about why they would be needing to go home at that time. Are they missing something they are not seeing? Are they tired and want to take a rest? Sleep problems. Due to confusion about time, it is not uncommon for your loved one to get days and nights mixed up and sleep on and off through the day instead of at night. Problems with sleeping at night can worsen mood and confusion the next day. Problems sleeping at night can increase the risk for wandering and falling. Sleep problems can increase caregiver burden, as it will often be difficult for the caregiver to also sleep well at night. Tips to improve sleep at night. In the evenings, when it is getting dark, also try to minimize lighting at home to provide cues that it is nighttime and time to sleep. Avoid the use of computers or TV 1 hour before bed, as the artificial light can be activating. The exception is night lights in the bedroom and bathroom to lessen risk of confusion and falls at night. Try to keep their bedroom as a place for sleep only. Avoid stressful activities like bathing before bed. Having a soothing nighttime routine, such as reading, listening to calming music after dinner, can also help encourage sleep. Do not give any caffeinated beverages after lunchtime. Use the bathroom before bed and avoid excessive fluid intake before bed to lessen trips to the bathroom. Having a commode at bedside can also make using the bathroom easier at night and less disruptive to sleep. If you notice loud snoring at night and/or excessive daytime fatigue, talk with your loved one's physician about a sleep study. Discourage napping in the daytime. Try to keep your loved one as active as possible in the daytime. Long walks in the afternoon may cause fatigue and encourage sleepiness in the late evening. Regardless of sleep the night before, attempt to wake your loved one at the same time every morning. This can encourage sleepiness at the same time every night. Tips for diffusing conflict at bedtime. Try not to force a bedtime. just gently suggest going to sleep if your loved one appears fatigued. If your loved one wakes up at night, gently reassure them as to where they are and reorient to time. Speak in a calm voice. Sit with the person while they are awake. While doing so, gently remind them that it is dark outside and time for bed. Avoid starting an argument at night. If your loved one insists to go out and sit in the recliner despite your encouragement for them to go back to bed, allow them to do so, as they may just fall asleep in the recliner, and this is far better than trying to attempt to change the behavior in the middle of the night and further interrupt sleep. Illness and pain. A sudden change in behavior may indicate an underlying medical illness. Your loved one may not be able to say that they are feeling ill, and so instead may start to act out due to not feeling well. They may also appear more confused than normal. Chronic pain can contribute to irritability in the daytime. Indications that someone is in pain include moaning and shouting, not moving a body part, crying out when an area of the body is touched, restlessness, and a refusal to do certain tasks. Tips for addressing pain and illness. Mention any sudden change in behavior, level of alertness, or worsening confusion to your loved one's primary physician so they can do a workup for any illness. Due to your loved one's difficulty telling you they are in pain, it is important to check for bruising, cuts, blistering, or sores so they can be addressed quickly. After a major fall, and especially if it involves any injury to the head, have your loved one evaluated as soon as possible by a medical provider, as there may be injuries that your loved one is unable to explain. Speak to your loved one's physician about scheduling pain medicine instead of giving pain medicine as needed, because it may be too difficult to control the pain by the time you notice the pain may be contributing to behaviors. Ensure adequate fluid and fiber consumption, as this will decrease chances for constipation. Constipation can cause stomach pain and increase risk for urinary infections. Regular exercise can also help bowel functioning. Regular dental checkups can prevent mouth infections, cavities, and abscesses that can cause pain and affect appetite. Ensure dentures are fitting properly and not causing pain as well. Depression and anxiety. Depression can occur in your loved one as a result of damage to the brain from dementia, as well as life circumstances such as the loss of a loved one and the loss of independence. Anxiety frequently occurs with depression. Loss of sense of time, frequent confusion regarding place and the people around them, hearing and vision loss can also make everyday activities stressful and anxiety-provoking. Anxiety and depression can look different in someone with dementia than in someone without dementia. Depression and anxiety can appear like irritability and anger, such as hitting, yelling, frequently arguing, and refusing care, because the person is no longer able to have the language ability to express their emotions. These emotions can also be a root cause for difficulty sleeping, poor eating, and refusing care. Tips for addressing depression and anxiety. Try to let your loved one know that they are understood, loved, and supported. Often knowing they are supported can lessen the feeling of being isolated. Encourage your loved one to spend time with people they normally enjoy spending time with. Encourage involvement in hobbies and activities that are enjoyable. Think about ways that you can modify the activity to their skill level. Consider speaking with their physician about treatments for depression. Remember, depression and dementia can be due to damage that occurs in the brain as well as social circumstances. Treating depression can not only make your loved one feel better emotionally, it can also make life more pleasurable once again. In summary, when a conflict starts, it can be helpful to remember this mnemonic that a situation can be saved with support. S in saved is for stopped. Have your loved one stop what they are doing to prevent further frustration. A for ask. What could be causing the argument? Think of the topics we discussed here. Frustration because they can no longer do the task, confusion, poor sleep, illness or pain, Are they anxious or depressed about something? V for viewpoint. Try to put yourself in their shoes. Would this situation be upsetting to you as well? D for distract. Is there something that you can replace the current activity with that would be less upsetting and easier to do? And finally, support. Let your loved one know that you are trying to help, that you understand why they are upset, and that they are still safe. This concludes our presentation on diffusing conflict and combative behavior in dementia.